So with that being said, it is 10 o'clock, so I will get officially started. It looks like most of you in the chat know me already, but if you don't, my name is Chelsea Gomez. I do work here at Action Benefits to teach you as much as I can about how to grow your business, better your business, and make the most money possible and do the best for your clients. And today I'm going to teach you about how to serve health insurance to those who have served you in the military and as a veteran. If you weren't in before I started, I just have to be clear. I am not a veteran, but thank you to those who are. So I do not have the perspective of what it is like from the veteran side of things. If there are any veterans here today who would like to tell us about that, they are more than welcome to do so, but I am not the person to ask. I am not a veteran. So today we'll learn about what types of coverage is offered to veterans, how veteran coverage interacts or doesn't interact with regular civilian coverage, what options veterans might have for under 65 and Medicare if they so choose to get to those things with their veterans coverage, and what products might be a good fit for veterans. I'm not going to go into specific like, oh, this particular plan, like, oh, this Humana Give Back, whatever, is the best one, this UHC 05. We're just going to talk in general. That is to you, I think, as the agent to figure out exact products. But if you have questions about anything, let me know. I will do my best to answer them for you. As you know, questions go in the chat or the Q&A feature, and I will answer them as promptly as I can. But just so that I know, because you know me, I like to know about you guys before I get started. Please, if you could be so kind as to type in the chat, you can either type it directly to me as the host, or you can speak to everyone that is in our webinar today. Please let me know which one of these things best describes you, whether you are new to every and all things I'm going to talk about today, or if you, I have talked to a couple agents before who want to specialize in working with veterans. If that's your what you want to do, that's awesome. Or maybe you have some experience with maybe you worked with a veteran before, but you just kind of, gloss through it. You're not sure, or maybe you are a veteran, and that's awesome. Thank you very much. Whatever it is, please let me know just so I know where to target our conversation today. Yes, it looks like we do have a couple account managers in here, action people in the chat today. So thank you guys for coming here with me today. If you have questions outside of this webinar or even during them, if you want to talk to your account manager, they love talking to you. They're the best, man. I just gotta say. Okay, so we have a good mix of either people. It seems like most people here are new to just working with veterans, but they do have some insurance background, which I love because I purposely structured this webinar to use and speak in the same way that a veteran would speak to you, like using veteran language, because I think that's important. I think we in the health insurance realm get kind of wrapped up in our own jargon and what we understand, and we forget that veterans are coming from a whole new world, a whole different world. At least for me, it's new and different, and I've never experienced it. But some might have a different point of view, and they're not used to our level of health insurance understanding and knowledge. And I will say, as someone who combed through some of this stuff to get to this presentation together, sometimes they will use regular health insurance terms. Like they will use words like copays and premiums to explain to a veteran what kind of payments they might need for coverage, but they're not really copays, or they're not really max out of pockets or something. So they might be familiar with some of our language that we speak, and they might not. So I'm going to try to help us as agents meet them halfway and use the language that they might use to describe what they're doing, so we can hopefully meet in the middle and have a great time explaining these things to our veterans. Before I jump in, I'm going to show this disclaimer once or twice to you guys. This information presentation is for the information in this presentation, there we go, is for context purposes. Of course, you are here to help your clients. I'm always going to tell you to do that. That is very big passion of mine and of yours as well, since you work with the clients. But you are not a veterans administrator. Just a reminder to yourself. So I am going to show you, like in some of these slides, exactly what kind of coverage is available to these veterans. but just keep in mind that you are not a veterans administrator, so don't go telling them some like about very specific details about their coverage or advising them whether or not to take veterans coverage or that's something that they should probably discuss with their veterans administration's offices and stuff like that. But I'm just telling you this stuff for context purposes. And also I'll repeat it like 500 times, never advise someone who's actively currently serving in the military. That's not for you. Leave them to do what they need to do in the military. We're here for them when they come home. So what benefits are offered to our veteran friends? Just for context purposes, I looked it up this morning. There are about 16 million veterans currently in the US. So if you have not ran into working with one already, you probably are going to. And the veteran group in general is changing, right? They are an aging population, I would say, not to say that some of our veterans aren't brand spanking new, right? But they are asking for a little bit more, a little different help than they have been in the past, according to some of the data that I've seen. So it's a good idea for you to get wrapped around how the veteran coverage will interact with other types of coverage, such as Medicare. So if you served in the military, there are two different options that you can have, and then there is a third one for those who have served along or were married to or dependents of someone who served in the military. So these are the three options. There's VA coverage, TRICARE, and CHAMPS VA. CHAMPS VA is not for the veteran themselves. Usually they're going to have VA coverage or TRICARE. Most veterans are going to have VA coverage. And then TRICARE is the less popular one, and you'll see why in a little bit. And then CHAMPS VA is the least popular of these three. Most of the veterans, I'm going to guess, are going to have VA coverage that you are going to work with. So these are the three that you will probably run into. And there's a whole bunch of different subcategories of TRICARE. We'll talk about that later. So we'll start with VA coverage first because that is the one that is most popular. It is called Veterans Affairs coverage, and notice I did not say it was Veterans Affairs insurance. It is technically not insurance. It is the actual definition. It's a benefit that veterans can apply for to receive medical care from a military doctor, right? So they might use the word insurance to describe it. It's not insurance. For their layman's terms, they'll probably call it that though. They're going to use words when they explain it to you when they're discharged and the veteran is like explained as to this coverage through their Veterans Affairs offices. They're going to use words like enroll in coverage, and they're going to talk about a network, and they're going to talk about copays. So they will probably think it's insurance based on the terms that they're going to have used with them to describe it. But it is technically, from what we understand, we know this is technically not insurance. What it will and will not cover is going to vary depending on the veteran, because this is meant to treat the things on your screen here. It's meant to treat illnesses and injuries, prevent future health problems, improve the ability to function, and enhance the quality of life of the veteran. These can be used at a VA, or should have to be used most of the time at a VA facility. There is special situations once in a while where the benefits can be used outside of a VA facility, but most of the time, overwhelmingly, you're going to be visiting a VA facility if you are a veteran who is trying to use VA coverage. And why I say it will cover something different for each veteran is because whatever is covered because a VA doctor says it was either caused by something that happened while they were serving our country, or the condition was exacerbated because of their time that they spent serving the country. So I can't say overwhelmingly, oh, this will always be covered by VA coverage, or this is never covered by VA coverage, because it's going to depend on what that doctor says when they go see that doctor, right? So for example, if they go to the VA doctor, if your veteran goes to the VA doctor and says, hey, my back hurts really bad, and they said, yeah, that makes sense because you did this, that, the other while you were in the military. That was probably caused by this problem that what happened in the military while you were serving. We will take care of this for you. And so then it's covered. They can go to VA doctors, have that taken care of. But if you go in there and say, "Oh, I have uh, breast cancer runs in my family," let's say, and I feel like I probably have it. Let's look that is not probably something they will cover. It's a hereditary thing. Or if you like break your leg in a skiing accident when you're 40 and you've been out of the military for many years, they're not going to cover something like that because that was not caused by the military or exacerbated by the time that they spent in the service, right? So just keep those things in mind when you are guiding your veterans, right? So maybe you get a younger veteran coming in and they're fairly healthy except for this one problem that they have, right? And it was caused by their time in the military. They might be okay with keeping just VA coverage for a while because they won't need any coverage aside from taking care of that condition that was caused by their time in the service. Maybe they're comfortable with that, or maybe it's the other way around and they don't have any problems that were associated with their military tour, stay, whatever. And they need coverage because they need that to cover what's going on. So that's why having a discussion with your client is so important, even if they're a veteran, right? That doesn't just automatically say, nope, we don't need to talk about those things. Yes, Danny. Yep. So that it's not, I always thought of that too, right? I was not a veteran myself. I had friends who served in the military and they all had military benefits, VA coverage. All my friends have VA coverage. And I just thought, yeah, they're sick, they just go to the doctor. I always like judged them low key for not wanting to use their benefits. I'm like, man, it's free benefits. Why aren't you using that? Because it is limited to the things that were associated with their time in the military. Obviously, while they're in the service, that's a totally different story. I don't want to speak to what goes on in the military because I'm not there. I'm not in the military. I don't know. But yes, for when they leave, also, Danny, keep in mind, well, everybody keep in mind, they're not automatic. These benefits, VA coverage is not automatic. You don't just get it for leaving the military, right? You do have to be not dishonorably discharged to get these benefits, and they are not automatic. You need to apply for them. So you can't be dishonorably discharged and you must apply. So that they may not get them even if like they may not qualify. I don't know off the top of my head what the application process is. I do know what you need to apply, but I don't know what they check to apply. Any RXs? I'm going to get to that, Dave. I'll tell you about RXs in a sec. Um, so ask me again once I go through that slide and you'll see if I answer your question. So like I said, not all veterans qualify for veteran benefits. For VA benefits, you either have to have served one day before September 7th, 1980. I had to go back, use my history minor for a moment. Nothing went on that day. Like that was specific that it's just that's when that law was passed. Or served at least 2 years of active duty after September 7th, 1980. Or you were discharged for a disability caused or worsened by active duty service, or discharged for a hardship or an early out. So my example here is either you served your 2 years and you were honorably discharged and you get VA benefits, or you went into the military and God forbid something happened to you where you no longer could serve, and that was a direct cause of something that went on while you in your service time. You are discharged for that problem. You are no longer able to serve. You get VA benefits. So it had to have been something that would cause you to not be able to serve any longer if you're not reaching that 2 year mark and we're serving past 1980, which is going to be, I'm assuming, most veterans at this point. We're going to be who are joining. Well, that's going to be all. That's how time works, duh. And then for the National Guard, you don't get VA benefits automatically for serving in the National Guard. You have to have been called to active duty and answered the call and completed the full period. Trainings do not count. And I don't think I said this. By veteran coverage, I mean all of the branches, right? I mean uh, Army, Navy, Air Force, Marines, and the Space Force. Um, so all of those branches. National Guard, you had to have answered the call and served the whole time, served the active duty, what you were assigned to. So the other things that affect whether or not you get VA benefits is your income, how many dependents you have, where you served whether or not you served in a combat zone, if you were exposed to dangerous chemicals while you were in the service, and where you are currently living. You can apply multiple times. So let's say you have a vet who just doesn't, they're like, oh, I'm fine and dandy. I don't want veterans coverage. And they don't apply for it. Let's say they turn 40, their back starts hurting. They're like, oh yeah, I remember that time I fell off of the horse or whatever. I don't know. I don't know why I thought it went to Civil War in my head. Anyway, so I fell off the horse and I need my back hurts. I think it hurts right where I fell. They can go apply after the fact, right? They don't have to apply right upon discharge. They can apply at any time. And if any of these circumstances changes where they might think that it will change their ability to be accepted for VA benefits, they can apply again. So if you do have someone who shows up to you and they're like, oh, I never applied, that ship has sailed, they can get the benefits after the fact. And then I'm telling you all this just for some context. Priority groups are the way that how the military determines the level of care and how much the care will be covered and to what extent the care is covered is based on your priority group. You are organized, if you are a veteran, you'll be organized into priority groups level 1 to 8. Those priority groups are determined based on your eligibility for Medicare, how many awards you have won and what awards you have won, your disability status, whether or not you were exposed to dangerous chemicals, and whether or not you actually saw combat. Oftentimes this number, but not always, oftentimes this number is expressed as a percentage, and whatever percentage that vet falls into determines their category. So obviously, 100% disabled means that that person is completely disabled, probably not able to work, probably had that happen while they were in the service, not always, but that's probable. And they would be in priority group 1, and they would have just about everything covered for them. And it goes all the way down to priority group 8, and they get organized that way. So, uh, as I said, this number might be expressed as a percentage, and this percentage is calculated by a few different things. They also keep in mind how much this disability or will affect the veteran's ability to find employment. So that also plays a role in what priority group they would be in. I was advised, and if there are veterans in here that can speak to this, let me know. Because like I said, I don't have experience in this personally. But I guess veterans are not always like told what their priority group is. It's not like on their like military ID or anything like that. They're not going to have that as a thing that they probably won't have that as a readily available thing they can like rattle off to you. But they will know their copays. Copays are determined, what they pay in copays is usually connected to their priority group. So they're probably going to know what copays that they have, and they are told in the veterans office, according to the veteran I spoke to, they're told to memorize their copays so that they know if they're getting charged improperly to take that up with billing with the provider. So they probably are not going to know the priority group, but they are probably going to know what their copay is supposed to be. And here is an example. I pulled this right from the manual. So these are just the priority group 7 and 8, just as an example. This is what the copays they'll pay, and they're told to memorize those copays so that they know what to expect to be charged when they go to these types of services. If your vet has an extenuating circumstance, like a service-connected disability rating over 10%, they might be in that priority group and then still wind up not paying these copays because of some other disability rating that has nothing to do with their priority group. It gets complicated. I don't want to bog you down in all the details, but just for your sake of being an agent, just ask them what their copays are. When you have the veteran in front of you, just ask what the copay is. And then if you can do better with the different coverage, get them that different coverage so you can have them pay a better copay or part of that copay. Otherwise, you're probably not going to be doing all this organizing into priority groups. But just for an example, this is what they look like. I will say, just because it kind of has to do with that slide before about inpatient care for veterans, and And this is also why I said at the top that veterans usually are in a VA hospital or VA facility to get care. If the veteran is in a actual emergency situation where any of the things on the screen here are going to affect that veteran, like delay of care would jeopardize health or cause terror to the veteran, they will cover things that would happen in a regular civilian level hospital. But that veteran is going to take a gamble then, because if they choose not to cover that, then the veteran would be responsible for any bills that are not covered by the VA facility. So when in doubt, if they want to use a VA options, always tell them to go to a veteran facility unless you're going to be able to prove that these things happened. And again, I'm not a veteran myself, so I cannot speak to how difficult or easy that process is. These are your urgent care copays for priority, based on your priority groups. You don't need to memorize these, but in case they come to you and say, hey, I have a $30 copay, then that's that you can tell what priority group that vet is in. I can't repeat it enough. I was told numerous times that veterans are told to memorize their copays, not their priority groups. So here's the copay for outpatient care. I'll give you the link to the handbooks too, so you don't have to memorize any of these things if you want them. So prescription drugs, there are no copays for priority group 1 for prescription drugs, and then groups 2 through 8 pay copays for outpatient medications. I'll show you the chart in a minute. But for VA benefits to cover prescription drugs, the drug needs to be prescribed by a VA vet, and OTC meds getting covered must come from a VA pharmacy. If your vet is low income, they might qualify for additional cost sharing for medications, but they would have to talk to that VA office. That is like a case by case basis. I couldn't find any specific information regarding that without having an appointment at the VA office. For this to be covered, like I said, it does need to be prescribed by a VA doctor. For that VA doctor to prescribe the drug, they must be the PCP of that veteran. The veteran PCP must have access to the non-VA medical records if that drug was prescribed by a non-VA doctor, by a civilian doctor. And the drug must then be re-prescribed by that VA doctor. So let's say your vet goes to the drug, they get prescribed Zoloft. They say, okay, you need this drug. They say, perfect. I want it covered by the VA. They'll say, nope, because that was prescribed by your civilian PCP. Next time they go to see a VA doctor, they say, hey, I was prescribed this drug. They can say, okay, yeah, I saw it in your records. Yes, I agree. You can take that drug. And then it gets prescribed by the VA doctor. Now it's covered by the VA. Here are the copay amounts for these drugs on the tiers. I could not find, well, I guess it would be linked. It's linked in the handbook that I'll give you later, what the list of the tier drugs are. But here are the costs for those drugs. These are 2026 numbers, by the way. There is also a $700 annual cap, which is the word that they use for a max out of pocket for prescription drugs. Yeah, sometimes they use our terms, sometimes they'll say, and sometimes they say things like annual cap. We'll talk a little bit about how it interacts with Medicare in a second, but veterans do also enjoy geriatric care if they have VA benefits. The vet pays copays varying from $5 to $95 a day for elder care that lasts longer than 21 days. It covers all the things on your screen there. Short-term, long-term care, respite care, adult daycare, short-term rehab, and long-term maintenance care. To apply, veterans need to have these things: a social security number for the veteran and any dependents that the veteran has, the military discharge paper DD-214, the exposure to toxins or other hazardous material details sheets, insurance cards, or information for any other insurance that they have outside of VA coverage, and the gross household income for the previous calendar year for the entire family of that veteran. I have a link to the application if you would like it. I'll just throw it in the chat now, just in case you want to just have that around for your vets. Okay. So veteran benefits and Medicare coordination, they can coexist with each other, but will not interact with each other. Hence why I wanted to cover geriatric care a little separately because yes, as we know, Medicare covers some of that stuff that I listed before, which is considered geriatric care for VA benefits. So Medicare will take care of some of those things, and then VA benefits will jump for the rest. But they will not and cannot talk to or provide or bill one another. So just keep that in mind if you're going to advise degular Medicare with VA benefits. VA benefits are considered credible drug coverage, and they are not considered credible medical coverage for Part B penalties. Whew, so I just said a heck of a lot. But overall, if you were to take anything from what I just said, each veteran situation is different. I would not use overarching words to describe, oh, veterans will always get their back pain covered, or they'll always get surgeries covered. It's going to depend um, on what is on each veteran, right? It's going to be very specific, and that's even if the veteran qualifies for VA coverage. I'm going to assume a lot of them must, right? I can't imagine it happens often where they're not, but just keep those things in mind when you are advising your clients who have VA benefits. All right, now let's check. George comes into your office and mentions that he has VA benefits. How do you infer from him what level of coverage the VA offers him, aka whether or not the VA is going to cover certain things for him and at what cost? What will you ask him? Well, I take a sip of water really quick because we've heard me talk for a while. Okay, so yes, those who are answering are picking up what I was putting down. Um, technically, almost all of these are correct. It's just whether or not you should ask all these things, right? C is kind of rude. I would not recommend you ask that. But technically that would tell you how much they're paying for things, but I would not ask that. I would just focus on asking what are your copays. Priority level is correct as well. Just if you ask that, the veteran might not know particularly what you're talking about. Because they're told in the VA administration offices to just memorize their copays. So, how long did you serve? If you said D, it's because you actually do have some knowledge of veterans benefits and you just don't realize it because you're going to learn about that in a second. So yes, technically all of these are the correct or can get you the answer you're looking for. It's just whether or not this is the easiest or the best, most fluid way to ask those questions. So now let's hop into TRICARE for Life, unless anyone has any questions regarding VA benefits before we switch gears into another topic. Okay. So a disclaimer once again, TRICARE, the word TRICARE means coverage for active and retired service members. It doesn't just mean retired service members, but that's who we're going to talk about today. Because again, you should not be advising someone who's currently serving in the military. So again, I'm going to give you some data or some information that's kind of like for context purposes. That doesn't mean you should be going around like telling all this stuff all the time to everybody. So just keep that in mind. Don't advise people who are in the military currently. That's not our bag, yeah? Okay, so I'm going to define just TRICARE for you really quick. So just TRICARE is the overarching body of healthcare that's provided to everyone who is currently serving, their families, or retirees. You might hear the word TRICARE, just TRICARE, thrown around, and it's kind of like saying you have Blue Cross coverage, right? Like you could have Blue Select, Blue whatever. Like there's a bunch of different types of plans within that. Same for TRICARE. I just have flavors because I think it's funny on the screen, but you've got TRICARE Select, TRICARE Prime, there's TRICARE Reserve Select, there's TRICARE Overseas, there's so many different versions of TRICARE. I'm only going to talk to you, and we're only going to speak to TRICARE for Life because we are not going to talk and tell people within the service what's going on here. And anything from this point on is just about TRICARE for life because you can get bogged down with so many different other things if you're going to talk about TRICARE as a whole. There's so many different co-pays, co-insurance, deductibles, but we're just going to talk about TRICARE for life because that's what we're going to make our live in as an agent is with advising people with TRICARE for life, right? So TRICARE for life is TRICARE's like final form, right? So you can have any flavor of TRICARE you want. You disenroll from the military, you keep your regular TRICARE. Um, you retire from the military, I should say. Correction, you retire from the military. TRICARE is only for people who retire from the military, not from people who just discharge honorably or otherwise. TRICARE is for people who retired, so you had to have served at least 20 years. And then once you get Medicare, you automatically get TRICARE for life. TRICARE plus Medicare is TRICARE for life. You cannot, if you don't get Medicare and you're a veteran and you have TRICARE, TRICARE goes away. You have to have Medicare to get TRICARE for life. Veterans are told that at the VA office. They know that. So if you do get someone who comes in with you who's about to turn 65, your advice for them, whether they have TRICARE or not, doesn't matter. Most of the time, probably gonna want to tell them to sign up for Medicare. If they're a veteran and they have TRICARE, 100% of the time, you're gonna want to tell them to sign up for Medicare. You want to get TRICARE for life. TRICARE beneficiaries should always carry with them two cards at all times. They should carry their Medicare card. They're still going to get one. And they should carry their military ID because that's what's going to get them their TRICARE coverage. And again, this is for only for those who retire from the military. TRICARE is for those retiring from the military. Medicare pays first. TRICARE is secondary. TRICARE can be balance billed, just so you know. So this chart just kind of tells you the how the secondary primary things just more hashed out. This is in, I stole this directly from the TRICARE for Life like brochure. I can throw that at you guys as well. This is what a veteran would be getting. So they will have seen something like this before. And then here is the cost sharing that is associated with TRICARE. This is, again, what the veteran will be given to explain to them what they need and what they should expect to pay. There is a $150 per individual or $300 per family annual deductible for TRICARE. But the deductible for TRICARE is only paid when TRICARE is the only payer. Oh, it looks like we got a question. Yes. Okay. Debbie, you're correct. I could have said that a little better. Yes. So you can have just TRICARE if you're under 65 because it is service like retire you're retiring from the service, right? You're not retiring like retiring. So once you retire from the service, you're getting TRICARE. You can have just TRICARE and not Medicare because there is going to be a group of people who could have retired from the military and still not be 65 yet. Yes. Okay. I wasn't sorry about that. Okay, then they have a catastrophic cap of $3,000 per family annually. It's basically an out-of-pocket max. They just call it a catastrophic cap. So, TRICARE for Life's Part A. Basically, this chart is just a fancy way of telling you in more detail for those people, veterans who probably aren't as familiar with Medicare as we are, that the chart just pays for their Part A deductibles and copays, and then TRICARE and the veteran are responsible for cost sharing after that. Here is the link to that handbook, by the way, in case you want it. Boop. And again, these prices are for 2026. So they might be different in past or previous or future years, I should say. And then we got our SNF coverage. Again, I'm just showing you these things just so you can be aware. And then you have your Part B, TRICARE for Life Part B coverages. So this is CARE's fancy way of saying they'll cover everything except for the chiropractic care. For after Medicare covers. So remember, Medicare covers first, then TRICARE. And then TRICARE's Part D. This is what TRICARE covers for drugs. There is a $3,000 max out of pocket. There is no coverage gap, and they do use Express Scripts. And again, this is in the handbook thingy that I just kind of sent to you in the chat just now. I'm just putting them out there for you to kind of gaze upon for just a moment. Okay, so veterans should always, and spouses, I should say as well, should always sign up for Medicare to avoid penalties because TRICARE is considered credible drug coverage for Part D, but they might have those penalties for not signing up for Part B on time. And they're gonna qualify for Part A because they had worked for enough quarters, right? Because they retired from the military, so they were working for enough. So there's that. I always try to not forget about the dependents and the family members because that's always a question that you are going to have to answer, probably if the vet is married. So this is the timeline of events of what the different avenues that veterans and their families can take once they sign up for TRICARE for life. So they're on regular, TRICARE, whatever select prime, whatever one they have until they retire. Once they retire, or not retire, turn 65. Once they turn 65, they turn up for parts A and B. The vet then automatically transitions to TRICARE for life when they sign up for parts A and B. And the spouse will then stay on TRICARE and they will stay on whatever version of TRICARE that they were on previous to that vet transitioning to TRICARE for life. So let's say it's on TRICARE, that spouse is on TRICARE Prime and they're only 64. They stay on TRICARE Prime for that next year. And then they transition to TRICARE for life once they are enrolled in parts A and B. So let's say they also have dependents, right? They have dependent children. That dependent child will also stay on TRICARE and they will stay on their version of TRICARE until one of these three things happens. Four things, sorry. One of these four things happens. Either they turn 21, not 26, 21. They turn 23. If they are enrolled in college, they get till 23 instead. If they marry, then they can no longer stay on TRICARE through their parent, their veteran parent. Or there is an avenue for them to stay on TRICARE until they're 26 years of age. It's called TRICARE Young Adult. That is similar to kind of the way that you would stay on your employer plan until 26. There is premiums and stuff for that. That they would get quoted through their veterans office. But that's for another episode. I don't want to get too deep into that. But that is an option to be aware of if that person wants to do that. But at that point, you're probably going to want to have a needs analysis with that particular dependent before you go around doing that. So Shane comes to your office. Let's do a quick knowledge check. He mentions his time in the military casually in conversation. What question do you ask him to infer your next steps for him? All right, good. You guys are picking up what I'm putting down. Technically, any of these are like things that will contribute to like the TRICARE coverage they might have gotten before they sign up for Medicare and get TRICARE for life. Those things could technically all affect what type of coverage they would have in overarching TRICARE. But the only one we would be concerned about as an agent is how long did you serve? If that person casually mentions that they were in the military, because that is going to determine whether or not they have VA benefits or TRICARE, right? TRICARE, as we saw, covers a little differently than VA benefits. So that's going to change your decision whether or not you're going to recommend them getting an under 65 plan, whether they recommend getting something a little different, because you're not going to recommend like a med sup for a TRICARE person that's all already covered. They got great drug coverage. They've got lots of stuff you probably aren't going to want to recommend to them, but it's good to know. So yes, awesome. Thank you. Champ VA. This one is the least popular and not as often utilized, but it is something you could run into potentially. So Champ VA is coverage for spouses and dependents of veterans who either rated 100% disabled due to a service-connected disability, rated 100% disabled at the time of passing, passed due to a service-connected disability, or passed on active duty. And that cannot be combined with TRICARE for life. You cannot get both of those things. So let's say you are a military spouse and your spouse passes away due to a issue um, that was caused by military service. That person, that spouse, and those dependents will be put on CHAMP VA. If they're 100% disabled, they would be put on CHAMP VA as well, the veteran. And remember, it cannot be combined with TRICARE for life. You get one or the other. Don't get both. So CHAMP VA is usually a secondary payer, including for Medicare. So just like TRICARE, it is the secondary to Medicare. It does count as credible drug coverage. It is terminated if the Medicare eligible beneficiary neglects to sign up for Parts A and B. It is partnered with Optum Rx for drug coverage and is Part D friendly. That's about all I have for you for CHAMP VA. Pretty easy, pretty straightforward. So then we have, last but not least, some dental and vision. It's a little, there's one for VA coverage and one for retired veterans. So we have the VA dental insurance program. I don't know how that is, if it's a VADIP, how it's pronounced. I didn't actually hear it, but I would just call it VA dental insurance program. It provides free dental care to veterans enrolled in VA healthcare or CHAMP VA. Not all will qualify and you must apply for it. Plans are managed through Delta Dental and MetLife. If the person applies and doesn't qualify for the free dental coverage, they will help them purchase a plan through VA DIP will help them, VA DIP, whatever, will help them buy a similar plan through Delta Dental or MetLife. I don't know exactly what qualifies them, but they do have to apply separately. It's not part of VA benefits itself. It's a separate day. It's a totally separate thing. And then I don't want to spend a ton of time on this one because it's not exclusive to military people. It is the Federal Employee Dental and Vision Insurance Program. So as you can kind of infer from the name, if I told you about this program outside of the context of this webinar, you probably wouldn't think it's for veterans. It is for government employees, right? So like my friend's mom, who was a male lady, has this, right? So it's not just for military people, it's for federal government employees. This is for those who retire from a federal government job. It is not for those who have VA benefits. Again, it is coverage of a variety of networks and carriers depending on region for retirees and their families, Medal of Honor recipients, and surviving spouses and dependents under 21. I will say too that this plan has been in the news lately for bills being proposed to increase funding for it so that they can have more wider network. I don't want to go too much farther into it other than they're looking to expand it and has not been approved yet, and that it doesn't seem to be very popular. There are about, according to the research I did, there's about 2.3 million veterans who could have this coverage, but only 888,000-ish used it last year. So either they're finding benefits somewhere else or they just don't have a need for dental vision coverage. I'm going to go with the former, is my guess, is that there's dental vision that's out there that we're providing to them. We're selling them as the health insurance agents that is better than what they're getting through the Federal Employees Dental and Vision Insurance Program. But that's just me. I'm biased, I like my agents. Okay, so that is all the direct things I'm going to tell you. I do have a little bit more for you, but that's the direct instruction portion of our show where I'm just giving you information. What questions do you have, if any, before I continue into other things? Okay, chat seems quiet, so let me know if there's anything. So just keep in mind that VA benefits are not all encompassing care like we imagine that at least I imagined that it was before I researched all this. So because they're not all encompassing, if there's anything you're going to take away from this today, always ask them what their co-payments are if they say they have VA benefits, and know that the coverage is always going to be different from person to person. If I were an agent and I was trying to look to help them make sure they were covered on all of their bases, I would discuss the need and their need for or their satisfaction with any specialist care that they're getting through the VA. I would discuss dental and vision benefits just because it doesn't seem like many vets are happy with the dental vision that is offered to them or available to them, or they're not qualifying for it because they do have to apply for it. So that would be an option to tell as well. And then any supplemental benefits, life insurance, accident, hospital indemnity, those type of things can help because it looks like, as we saw, right, they are still paying copays, especially in those lower priority groups, fairly high copays for that time that they're spending in the hospital or what have you. Or if they have an accident, it's not covered through the VA or non-emergency stuff, right? TRICARE for Life, this is going to be a little more difficult of a sell because TRICARE for Life is pretty comprehensive in comparison to the VA benefits, not limited by what a VA doctor might say is covered and what isn't. Just remember that if they do, for some reason, choose to get an MA plan, and like you probably have heard, and if you do work with Humana, there are some plans that are designed specifically for veterans. And basically, what those plans do is they allow the person to utilize that VA drug benefits because, those drug coverages, as we saw, they get a pretty good drug coverage, just so long as those drugs are covered either prescribed by a VA doctor or with TRICARE for Life. They don't have to be, they get pretty good drug coverage. They might want additional coverage, even past TRICARE. They can get in a Medicare Advantage plan. We saw that, that I think it's called the USA Honor and USA Honor Give Back. Those are good options. They could be depending on what your client has, if it's available in the service area, so on and so forth. So that MA plan would pay first, then Medicare, then TRICARE. If you are looking to sell that plan to them or to see if it's valuable to them, you would be asking, about their interest in a Part B give back. Or there's other items that would go along with that MA plan that might be of benefit to that person. And then my other thought there was checking with the formularies. I'm not going to lie, I'm not going to pretend like I have the entire formulary for TRICARE for Life memorized, but I did look at a popular drug. I looked for GLP-1s. They were not covered under TRICARE. So if it makes sense that maybe your client is on a GLP-1 and they have TRICARE for Life, it might be a good option to go with an MA plan that covers those. If they are on one of those plans, might be an option. There's also an opportunity to sell those ancillary products to cover maybe a hospital stay, to cover some of the income lost at the time of that hospital stay. Whew, okay. So I wanted to throw a couple sample clients at you because I think the best way to make sure that you understand and picked up the things I put down is to try to apply them into what you would do as an agent. So I have our first victim, or I mean client, in front of us today. We have Marla. She is a veteran. She is 37, and she is a self-employed personal trainer in Southfield. So in the chat, really quick, if you could be so kind, I purposely did not give you much information about Marla because I'd like to be curious to see what questions you would ask her, to see what coverage she would take or what you might recommend before she gives you any additional information. And I'm going to show you kind of what I might do through a needs analysis with Marla if I were her agent. Bonnie, yep, good question. How long does she serve? Yeah, I mean, she might have a gun. I hope she might. She might have a concealed carry light. I don't know how it works in the military with that kind of stuff, Danny, but I mean, if she brings it with, just I guess try not to make her mad. I don't know. Yes. Bonnie, you could ask her how long she served. Because she's 37, no, though, I have a hard time believing that she served 20 years in the military. So I bet that she doesn't have TRICARE, but she probably qualifies for VA benefits if she served longer than 2 years. So for this extents and purposes for our show, I'm going to say that she served at least 2 years and she does qualify for veterans benefits. Yeah, if she would, yes, Jessica, she would have had to. I purposely picked that age just because it was like it could maybe, but probably not. Um, so I did a needs analysis of her. She made $52,000 a year, and so that made her eligible for subsidies. She's can attend VA hospitals, so that means she did have VA benefits. We asked her what her priority level was, and she said she didn't know. So I asked her what her copays were. She told me that she had a $30 copay for urgent care. So she's probably in priority group like 6 or 7 or 8, 6 or 7. See, I don't even have them memorized. Like 6 or 7 probably. She did say that she sees a VA provider for back pain treatment, and she does have a back pain tier 1 drug. So she pays $15 a month for her 90, or not a month, I'm sorry, $15 for her 90-day supply of her back pain drug. And then I went to this VA find locations thing. I'll put it in the chat for you here to try to make sure that she would be comfortable with her, because remember, VA will cover emergencies if you were too far away from a VA hospital. I just went through our area and searched emergency care in our area. That arrow is where she lives right there. And then those are all the VA hospitals, is the numbers there. I don't know about you. That seems kind of far to me for a hospital for an emergency situation. Maybe she's comfortable with that. That's up to her and up to the discussion you'd have with her. I would feel a little woozy if that were me thinking that the closest hospital is that far away, if that's where she lives. Maybe it's a good idea to talk her into an under 65 plan at this point. Or it's a good idea to not do that. If she is totally comfortable with that, that's up to her. So either either way, I'd probably see if she'd like some dental vision coverage because we don't know if she likes the VA. We don't know if she would qualify. You could tell her to apply, right, for those dental vision benefits. We don't know if she would qualify. So I would tell her vision, regular dental vision, civilian dental vision coverage. We at least know for sure she would qualify for. If she's happy with only her VA benefits, you could try to see if she wants some life secure accident coverage to cover those hospital copays that we saw, those $342.20 level copays. And then if she wants more coverage and wants to be able to just not go all the way over to wherever that VA hospital was from Southfield, then she could probably use her subsidies to get a silver plan and then see if that one drug is on that copay for a $0 uh, tier on a silver plan, maybe not, or it can just continue to be covered by VA for that 15, sorry, dollars. Okay, one more before we leave. I have 6 more minutes, so we can probably knock him out really quick. So we have Marcus. He is 66 years old. He is a veteran. What should we ask Marcus before we dive into how to pick some coverage out for him? There is one thing that would dramatically change the conversation for Marcus. Yep, Danny's got it. He's got the fastest fingers. How long did you serve? Because if he retired from the military, he's got TRICARE. If he served for 2 years, he's probably eligible for VA benefits. If he did not serve that long, he's not going to have any coverage at all, right? So if he has VA coverage, I made this nifty little chart for you. If he has VA coverage, then he has a service-related problem, then the VA coverage is going to cover it. If it's non-service related, then you're going to hopefully advise him that he already signed up for parts A and B and get a Medicare Advantage plan. And then TRICARE, as we know, we TRICARE, he signs up for Parts A and B, TRICARE for life, and then and only then, once that's squared away, is when we could decide whether or not it's a good idea for Marcus to take a Med Advantage plan along with his TRICARE for life to supplement some of that other stuff, or he can not do that if he's just happy with the TRICARE coverage that he has. I don't want to go into all the nitty gritty since we're running low on time about what we would talk about for picking out exactly that because that's just going to be like a regular. If he does want a Med Advantage plan, it's going to be similar to picking one out that doesn't have a drug coverage if that person doesn't need drug coverage for whatever reason because they get such good drug coverage with their TRICARE for life stuff. So if he's happy with his TRICARE with already, then he would just want his parts A and B. You might want to look into a dental vision hearing or a potential hospital indemnity plan for him. If he still wants additional coverage, you'd probably treat him very similar to a regular client, like I said, minus the prescription drug portion of the show. And then potentially throw some hospital indemnity at him, like we said before, because he might be missing out on income while he is hospitalized. The only exception that I would have to this situation is if the prescriptions that he has is not covered by VA, or I'm sorry, by TRICARE. Like I said, not Ozempic, what's it called? GLP-1s, those are not covered. So if that's something that he's interested in, maybe a Med Advantage plan there. That's just one example. I don't have the entire formulary memorized. Okay. So if you are going to remember anything I told you today, here are the things you should remember. The quickest of highlights. VA Benefits is the most popular option out of the three I showed you today. It is not technically insurance and does not interact with other health insurance. It is not totally free and does not cover every single thing. The way to get to a vet's heart, to the nitty gritty of understanding whether or not you would tell them to get prescription. What am I talking about? Get marketplace or employer group plan or whatever is if what their copay levels are, that's going to tell you a lot about what kind of coverage that vet might be enjoying. Under 65 may or may not want coverage based on their needs. Medicare beneficiaries might want an MA plan, they might not. They probably will. But I can understand not as well, depending on the situations are. You're still going to want to do needs analysis. There's not one size fit all solution for every vet. TRICARE coverage is fairly rich, but isn't available to the bigger percentage of your veterans. They're going to have VA benefits instead. Make sure that they get A and B so they can keep their TRICARE for life. Here's how you can target some veterans if you are an agent who is interested in working with more veterans. Here are some ways you can do that. And here's some action items you can take away from today. Give Medicare one-on-ones at a veteran center. Ask if VA or TRICARE, if they have VA or TRICARE during the needs analysis. Bookmark a copy of the TRICARE for Life Handbook, which I'm about to put in the chat for you, along with the Veteran Services Locator, which I think I already gave you earlier, but there it is. Some of this stuff is available online to look at, and some of it is not. Some of it I had to go to my own presentations to find this information or go researching. Some of it was just available online. Don't advise people who are currently serving. And be nice to veterans, thank them for their service. Otherwise, that's all I have for you today. Thank you for spending the time with me. What questions can I answer for you regarding veteran coverage? Yes, Humana does give great presentations on interacting with veterans. That's kind of what they're hanging their hat on. Like, how UHC kind of does the AARP thing. Humana does veterans very well. I did get some of my information from that FAQ that Jessica is referencing there. She can get it for you. If you have the link already and you can drop in the chat, just do it. I don't have the link off the top, but yeah. Oh, okay. Um, I'll talk to you in a minute, Jess. I can maybe put it in the email to out that comes out tomorrow with the recording of this webinar to them. But yes, if you're interested in learning further, and if you're interested in learning the stuff from the perspective of a veteran, I would go watch Humana's version of this because they have two veterans who are wonderful. And that's where I got some of this information was from those two. Humana people, if you're with them, and if you're not, you should get with them. Talk to your account managers so you can get that started for yourself. Otherwise, I am exactly 1 minute over, which is really good for me, because you know how much I love telling you guys stuff that I know and teaching you guys things. So unless there's any questions, I'm going to leave it off for today. Thank you for spending time with me. You know that my favorite part of my job is coming here and talking to you guys about how to grow your business and do things a little bit better for yourself. If you want to talk to me, email me or email learning@actionbenefits.com or call that number, and our lovely people on the phones will send you off to where you need to go. Otherwise, try not to drown out there with all of the water. Uh, Hopefully, you have your dehumidifiers running in your basements. And have a great rest of your day.